Okay, so now we have Mary Kate Wells here. She's from the Nevada, or I'm sorry, she's from the National Council on Independent Living. She's the director of programs there, and she's going to talk to us about the barrier removal fund. Welcome, Mary Kate.
Hi, everyone. Thanks for letting me join your call. It's kind of perfect timing, so I'm excited to share about an opportunity that we're working on that touches on the Nevada IL network. Um, as John said, my name is Mary Kate Wells, Director of Programs at NICL, or the National Council on Independent Living, which is advocacy and membership organization for the Independent Living Network. And in my role, I manage all our projects and grants. And one of those is the Barrier Removal Fund, which Nickel helped develop in collaboration with Centene Corporation back in 2018. So I'm going to share my screen. So today I just wanted to share kind of the project that is coming to Nevada and how over the past several years we've collaborated with the different state IL networks to like the project name, remove barriers by giving grants to healthcare providers. So I am sharing my screen. I have some slides. I'll also share that out if that's any folks need that for accessibility. And as I'm going along, if there's questions, feel free to jump in or chat. However, I want this time to be useful for your group. So, all right, I'm just going to jump in. So, just a little background about this project. So Centene Corporation, which is the corporate MCO, managed care organization, has this initiative called the Provider Accessibility Initiative. And in collaboration with Nickel, we're really striving to provide equal access to healthcare and services that are physically and programmatically accessible for members with disabilities and their companions. And one of the goals is to improve access and healthcare outcomes by increasing the number of healthcare professional locations and services that meet the minimum federal and state disability access standards. And on the screen is an image from our last year, one of our last year projects of a person who's using a wheelchair pressing an automatic door opener. So that was one of the projects we were able to fund through this project. So there's kind of two objectives with this project. One is to increase the accuracy and transparency of the disability access data on their provider directories. So Centene has a directory of other providers, and they have the option to include in that directory a list of accessible equipment that they have and accessibility features at their practice. Which is really awesome because if you're a person with a disability, different types of disabilities, and you need a certain equipment, maybe it's a accessible exam table, you would be able to search if that provider had that equipment. Second part to it is that healthcare providers, we pick 2 to 3 states each year to get access to competitive grant dollars. And providers that apply and are chosen receive a on-site accessibility site review completed by a local center for independent living. And that funding is to remove a priority disability access barrier. So kind of it is really holistic in that the healthcare provider, if they're found eligible, even before they're granted any funds, they have to complete this accessibility site review to make sure that, like the example I always use, if they ask for an accessible exam table, that they also have an accessible entrance, right? Because if you don't have an accessible exam entrance, then how is a person with a disability going to have access to the exam table? So through this partnership between this local sales and the local healthcare providers, they also get that education and awareness, not only on the physical accessibility, but also attitudinal and other types of disability access. Um, so the type of projects that we fund well, there's three types. The removal of physical barriers that so that a person with a disability can enter, use and leave a healthcare building. The second is purchase of adaptive equipment for medical diagnostic equipment that meet the U.S. Access Board standards. Um, an example of that is accessible exam tables, accessible weights, mammography equipment. Last year we did a chiropractic table, which was really cool, and also a dental, wheelchair accessible dental chair. And then actually, sorry. And then on the screen is an image also from last year of a reception desk with a lowered counter on one of the sides of it, so that someone, if they're using a wheelchair or other mobility devices, could have access to the counter. The last type of projects that we fund through this project is programmatic access. So that is a range of items from accessible formats for print material, communication access, so like communication boards, picture boards, assistive listening devices, equipment to reduce auditory, visual, or tactile distraction. So I think a more layman term is like sensory items. So noise canceling headphones, color communication badges, replacing fluorescent lighting, which on the slide is an image of a workman putting in new lighting at a healthcare provider site. Also to make the other categories dental services more accessible to folks with intellectual and developmental disabilities. So weighted blankets, weighted stuffed animals, DVD players, all different type of projects like that. Okay. Just some, I don't know if any folks here are like statistics, but just some project statistics I just think is really cool. Since 2018, we've gotten over 900 applications from healthcare providers across 16 different states. Centers for Independent Living have done 524 on-site accessibility site reviews by almost 90 different centers for independent living. I just, for me, I don't know. This is also like one of my favorite projects. I just like talking about it, but it's just really cool to think that, we have about 300 healthcare providers who got grants, but over 500 have had an interaction with their local Center for Independent Living, which in theory we would hope would just start improving access and inclusion with those healthcare providers. And we've provided almost $3 million into grants for healthcare providers, which is really exciting. On the screen, I also have a list of the states we've been in before. This will be the first year in Nevada, which is exciting. Our other state this year is Illinois. Okay. I wanted to share a little bit just about the accessibility site reviews. We will be doing a training later in March 18th, and I'll get this information to Dawn to share, and I'd welcome this group to participate in the training if you wanted. It's going to dive deeper into the accessibility site review, but just a little overview. This is like a really critical part of this project. As I was saying, we partner with the local sills. Nevada's going to be interesting because there's only two sills for a very large state. And on the screen is a picture taken at one of the site reviews of an entrance of I think it was like a pediatric office, and it only had a lever handle, so it didn't have an automatic door opener. So that on the next slide, I think, or maybe not, I might have not put it in. One of their projects was to make an accessible entrance. But as I kind of shared, the purpose of these accessibility site reviews is to determine if grantees' overall accessibility for patients and other visitors with disabilities. Um, so not just looking at what project they ask for, but just the whole office and practice. Ensure that grant improvements and purchases would adequately remove the barrier, kind of like the example I mentioned earlier. Um, every healthcare provider that's found eligible gets an action plan, so that really encourages them to correct other access issues identified in the survey. And it also just shares a summary of findings with the health plan consumers so that they can then select a provider or a location that meets their access needs. Um, So just a little snapshot of what this looks like in practice. It's an in-person meeting. Usually it takes about 2.5 hours with the SIL and usually someone who works in someone who works in the office. And we have this ASR tool. It's like a survey. Well, it is a survey, and also this action plan. And the tool looks at 4 areas: parking, so outside entrance slash exterior building, inside of the building, and then the programmatic access. Um, they do look at like parking. We've a few years ago had a project that resurfaced. It was a very rural healthcare provider, and we resurfaced their parking lot so that um, someone and then did some striping of the parking lot for ADA spots. Um, just so you're aware of like what the interaction looks like with the SILs is the SIL schedules and coordinates the on-site accessibility site review. They do the site survey with the healthcare provider using this ASR tool. They complete the recommendations and the action plan, and throughout the process providing training or technical assistance to the healthcare provider as they go along. And then they would just email it to me. So I'm realizing I didn't change this to 2026, but just so folks are aware kind of our timeline. We are currently have an open request for proposals, RFP for healthcare providers in Nevada they have to be Centene providers is one of the big eligibility. So we're currently collecting those. I think we had 10 so far in Nevada. So we've had for the first couple of weeks, a good response. At end of March, we'll start working with the SILs and potentially some SIL folks, depending on geographics and stuff, to start scheduling the ASRs, and they'll have a few months to do those. And then in June, we have a committee decision or decision committee to determine the final awards. Something cool about that is it's folks from the health plan. It's usually someone from the IL community. There's other potentially healthcare providers. There's other advocacy groups. So it's a very diverse committee so that we kind of can be able to think of and determine impact from a lot of different perspectives. And then the funds are dispersed in August, and the healthcare providers have until the end of the year to finish their projects. And then this is just a note. probably not as applicable to this group, but once we have the list of eligible providers, probably a little less applicable in Nevada where it says that a SIL is not guaranteed an assignment just since there's only two. Um, but yeah, just this is just a slide about a little bit of sharing how we make assignments. Um, and this slide is just a little bit about the ASR tool. It's just a note to we want to make sure that we fill out every question. So the health plan, we have like all the information we need to make the appropriate recommendations and solutions. And then I think I took this from the survey tool. So if you're able to join us on March 18th, then we'll dive deeper into the ASR tool. If you're curious, I can also share it too. So let's see. Okay, those are my slides. I love if anyone has questions or I definitely can send the slides out too if that is helpful to folks.
This is Dawn Lines. Thank you, Mary Kate. I really appreciate that presentation. And I would love to have your slides so that I can post it to our website so that everybody can access that. I also, oh, Stacy, you have a question?
Yeah. Thank you. I found it pretty interesting that yeah, you reaching out to all these states. So I was curious to know how many people actually are you reaching out to in these states, like estimate client.
How many providers are we reaching out to?
Yeah, and how many clients do you have typically? Yeah.
I don't have that data right now. So it would be the number of eligible Centene healthcare providers. So I don't have that info. I can get that information and get back to you because I don't know how many Centene providers there are in Nevada. So
Okay.
sorry.
Thank you.
Mark Tatter, I have a question.
Go ahead, Mark.
So I'm wondering, the incentive to the medical providers is that they would be in the directory and they would have sort of hopefully a good score, but that would also open them up to the ability to get grant funding for upgraded equipment,
Yeah.
accessible equipment. That's
Yep.
kind of the deal.
Yeah. So the incentive for them is they get the grant dollars. So we have $100,000 per state. So they're competing for that funding. So whether that's accessible exam tables, lighting, parking lot, entrance, reno entrance. So yeah.
Because I was wondering, what would be why would they want to answer some of those questions unless it was going to be a good answer? That's what I was wondering. How
Yeah.
are we going to
Well,
get them to say that or want to, answer some of that stuff? But that makes sense.
yeah, and we make the ASR requirement for them to be considered for the funding. So they kind of have to if they want the money.
Yeah, definitely.
And we do pay the sales, like there's also incentive for sales too. So yeah.
Dee Dee,
And
you
can
have
I
a
ask,
question?
Thank you very much, Mary Kate, for the information. I do want you to know that I am out in the rules along with my coworker, um, Margaret, that's out in the Elko area. So we're in the rural areas, and I'm not recognized as a Part C center, but we are out in the rural areas. So, and I was wondering if uh, how someone would access this grant for our rural area providers.
Yeah, great question. And thank you, Dee Dee, for clarifying. I know every cell network's different and funding and stuff. I can share on Nichols' website. There is a page for the healthcare providers that will find the application info and eligibility. And you all are welcome to share that. I mean, the biggest eligibility requirement is they have to be a Centene provider. Also, it can't be a residential or hospitals. It lists that, but if you're like, hey, you have a connection with a health system or something, and you're like, hey, just this might apply to you, feel free to share that. I can share that with Dawn to.
Yeah, I have a provider here in the Carson City area, as well as, out in the Lyon County areas that I have connections with, that I would really like to be able to let them know about this. Because in the rural areas, we don't have accessibility to a lot of things like that. And I think it's important that we allow our healthcare providers out in the rurals to be able to utilize those grants.
Yeah.
Thank
And
you, Mary Kate.
yeah, I see Dawn just put it in the chat as well. And this actually is the first year we got feedback from folks sales last year, like, hey, we'd love to help outreach because you all have the connection. So please, especially I hear you with the rural areas and healthcare access. So
Yeah, it's very difficult in the rural areas for healthcare access, um, and especially for any accessible equipment. I mean, I'm still saying, okay, when I go in with clients, okay, you need to put handholds here near the weight,
mhm.
and where you're weighing in people, and so accessibility is a real big issue in the rural areas. Thank you, Mary Kate.
Yeah, Mark Tatter, I have a comment. So I'm an ADA program coordinator, and I was looking at the scoping and some of the stuff. It looks very similar to the things that, the University of Missouri,
Mhm.
puts out to talk about. And we're going to have all 6 of our staff member attend the training on the 18th. We're very interested in this, and we cover basically every county in Nevada outside of Clark County.
Okay.
And we're very situated to help with this program. I'm looking forward to it because I think, as Dee Dee said, there's a huge demand. The rural communities and the frontier communities, especially,
Yeah.
they need some advice, if nothing else. And the grant funding is definitely a huge incentive. I think that's a win-win for everybody.
Yeah. Same. And awesome. I'm glad to hear that. Yeah, the tool follows very similar to the ADA checklist. There's a few like additions. June Callis, she's in California, helped develop that as well. So
Mary
Very
Sizer?
cool.
Mary Evilsizer, I'm sorry, I forgot to introduce our guests, Mary. If you want to give a quick introduction. I'm so
Oh,
sorry.
that's all right. Hi, and good afternoon, everyone. My name is Mary Evilsizer, and I'm the Executive Director for the Southern Nevada Center for Independent Living. And Kate, it's good to talk to you again. Kate and I have had some conversations, and I just wanted to say that the Southern Nevada Center for Independent Living is also very interested in this project and happy to see steps towards accessibility in the medical arena. And also to let you know, Mary Kate, I think I've already mentioned this, but in Nevada, we have the Southern Nevada Center for Independent Living. We cover all of Clark County. And then, of course, we have our sister center, Northern Nevada Center for Independent Living up north. And then what I wanted to find out is 2 questions. And like Mark, we're excited to have this project. So, but however the chips may fall, they fall. But we're going to go through the training and participate. Number 1 question: would you please clarify what is a Centene provider.
Yes. And let me double check because I've been mixing because I have the two states. So I want to make sure I give the right health plan name. So 1 second. Silver Summit Health Plan is the Nevada.
Okay, Silver Summit. Okay.
Yeah.
There was one more, I think, but I'm not sure.
The other one, well, it's for the other state. So it's for Nevada, it's just Silver Summit.
Silver Summit. Okay, thank you for
Yeah.
that. And then Silver Summit. Then, okay, there's $100,000 that will be awarded via a request for proposal by the medical providers. Is there a cap for each award that's given to each medical provider?
No, I'd say a range is and have in the RFP is like 500 to 10,000. So however we've done larger projects before, it really depends on the number of applications we get and potential impact. So at those decision committee meetings, we score them, we look up how many consumers they serve. Are they rural? Do they meet a specific community? So we take all of that under consideration.
Okay, so it depends on the variables, I understand. Okay, so up to 10,000 perhaps. Then my last question is, in other states where the barrier removal program has made an impact, you mentioned that there were 524 ASRs completed by 90 SILs. And so what I did, don't say, oh, what a numbers geek, but I did crunch the numbers. And so that means that each CIL did 5.88 or 6 ASRs in total. Does that sound about right?
Yeah, I'd say probably, we have had some that do one just because of service area. However, just due to the nature of Nevada, I would assume it's going to be more than one. And in some states in the past, like 2 years ago, we did Florida and we got 100 applications, 100 ASRs. So like some got 10 to 15, but I would say 5 is a good,
Okay.
good estimate.
Very good. So it won't be coming out of the woodwork then. It's okay. Thank you. I appreciate it, and I appreciate all your information. So thank you so much. And then, Mary Kate, one last question. I think you may have answered it, but for example, like if the CILs are interested, is there a form or an application that we would fill out, or what is the process for that?
Yeah, no, so I think talked to most of you. So what will happen is once we get all the applications and do eligibility, I'll reach out to you all and say, hey, we have 3 providers in your service area. Are you able to do the ASRs? And then if you say yes, I have a very simple service agreement that just outlines that, but no pre-work. I'll reach out directly and say, hey, we have this many providers, or I'll let you know either way if there's like no providers. And then typically, depending on each sales capacity, there might be situations where you guys might tag team, and I'm happy to coordinate or however you guys, whatever works, really.
Okay, thank you. I just didn't want to miss any paperwork that we're supposed to send in because that does happen.
It does.
So anyway, thank you so much. I do appreciate your answering all of our questions, and thank you for whoever selected Nevada.
Yeah.
Yeah.
I didn't, but I'm excited. So
Okay, Dee Dee, you have your hand up still. Did you have another question? I'm guessing maybe she got a phone call and forgot that she raised her hand. So I'm just going to leave it at that. Thank you so much, Mary Kate. Also, we had a couple extra people join us since I introduced everybody, and then I also forgot to introduce our guests. So I just wanted to make sure I gave everybody a space to introduce themselves. We'll start with Sandra Cosgrove. Would you like to introduce yourself, Sandra?
Sure. So Sandra Cosgrove, I'm a history professor at the College of Southern Nevada, and I have a nonprofit called Vote Nevada to help make sure if people want to be engaged in advocacy, that they kind of know how to interact with our elected officials.
Thank you, Sandra. And then Alicia Santiago, would you like to introduce yourself as well?
Yes, good afternoon. I'm Elisa Santiago, and I'm with the Southern Nevada Center for Independent Living, and I work closely with Mary, and thank you for the invite.
Thanks, Alicia. Amanda Mata, as our administrative assistant. She's taking notes. And I know I'm forgetting someone here. Cecilia Alonso, would you like to introduce yourself?
Hi, good afternoon. My name is Cecilia Alonso. I'm regional coordinator at ADSD.
Thanks, Cecilia. And I also realized Lori Lutu also arrived late and would like to, maybe you'd like to introduce yourself as well, Lori.
Good afternoon. Sorry, I was a few minutes late. Yes, I'm Lori Lutu. I'm also a regional coordinator with ADSD down in Clark County.
Thank you. And does anybody else have any more questions for Mary Kate or anything else they'd like to add to the conversation? Okay. Well, thank you so much, Mary Kate. I appreciate you coming and telling us all the great information about that program, and look forward to working with you shortly.
Awesome. Thank you so much. And feel free to contact me. I'll send you the slides, Dawn, after. So thank you.
Thank you. So one thing I noticed, or that I didn't do, is I forgot to tell you guys that I'm going to do the public comment differently for this meeting. So, you know, we can either do a public comment at the beginning or end of the meeting, or we can do a public comment, allow for public comment after each agenda item. And I'd like to just let you know that I plan on doing the public comment, allowing for that after each agenda item for this meeting. So that being said, I want to allow for any public comment. And so I need to read as Julie calls it, the preamble, and then I'll open it up for public comment. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be allowed at the beginning and end of each day or of each agenda item and will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and spell their last name and provide the secretary with written comments. Is there any public comment? Hearing none, I'll move on to the next agenda item, which is discussion regarding updates to outreach efforts of committee members. We all had, or most of us anyway, had a task to perform and come back with some information. I know Julie couldn't be here today and I didn't receive anything from her, so we'll go ahead and give her a little time to come back to us with her information about Centers for Independent Living. But unless the Centers for Independent Living have information that they can share with us on the fly about outreach efforts you know, for any medical training that they provide to providers already in the community, or if there's anything similar to that going on through the Centers for Independent Living. Maybe Mary or Mark might have some information if you'd like to share. Mary, go ahead.
I would like to share that the medical community right now is very hard to train. Number one, they're understaffed. Number two, um, when you're trying to provide with an olive branch, of course, access issues, it doesn't fall on deaf ears. It's just like, why are you telling me? So we're excited about this program for the barrier removal. And also, I think there's been enough, how do we put it, uh, awareness through social media, through legislation, that the medical community is in need of awareness for accessibility. How we do awareness for medical needs is we do it on a one-to-one basis. I can tell you that I one time personally worked with an individual, and it took me 4 hours on the phone to get their records. It's not that the medical community isn't willing to respond. It's they have problems with their infrastructure and their system. And so that's how we're doing it. We don't have a national or a local campaign to train medical providers, but we do try to have them know that we are here in the community and that we do support our consumers. For example, we've sat with our consumers while they make an appointment or get a referral because they're having issues. We don't go in as advocates because we don't fill out the paperwork to be their advocate. We are there as peer support to help them accomplish their goal. So that's how we're handling advocacy for the medical community. Again, it would be wonderful to see, a social media campaign and this grant through barrier removal. I'm sure will do a lot of great good. Okay, that's my 2 cents worth.
Thanks, Mary. I'm assuming probably Northern Nevada Center does much the same, right, Mark?
Yeah, we actually work sort of with individuals, particularly with inaccessible, documentation, things like that. We've also worked with some particularly rural organizations with medical transportation to get into facilities like in urban areas, be it Las Vegas area from Pahrump or into Reno, Sparks. So we work with them specifically, often provide advice. We have sort of lists of when transportation's available from places like Fallon to help out with maybe doctors in particular who need to send people in for that. And so it's kind of an ad hoc, it comes up. We don't have an organized plan. But if you guys have something like that would be interesting to learn about. And then we have a really good relationship with all the ophthalmologists and stuff because they are very aware from former and prior campaigns about, low vision technique training, blindness, and stuff like that. So they're more than happy to recommend us. We've sort of built trust with them over the last 6 or 7 years, and they know they can call us and we can help out with their patients so that they're, better patients also and more independent and able to use the medical facilities as needed. But that's kind of what we've been doing.
Thanks, Mark. Yeah, it's good to hear that the Centers for Independent Living at least have established relationships somewhat and can, provide that one-on-one support that's needed sometimes. Mary, did you have something else to add?
I did, Mark, in regards to, do we have something that we use? You like us, we've all received ADA training. So we all still have our little handbooks from when we first started doing assessments everywhere we went. And so we have been relying, and I believe you became a certified individual through Pacific Dab Tech to conduct, assessments. So with the centers, we've had experience just for years and years following the guidelines of the ADA, and then on a day-to-day basis with our consumers and training them in self-advocacy. We try to train them in those about those regulations and their rights. And again, with the medical community as well, because we do get consumers a lot of the time that will say, I'm going to physical therapy and I can't even make it through the door. Can
Yeah.
somebody just give them a call find out what's going on or go down there. Then we go down there, and it turns out physical therapy is following the, what is it, the fire codes. And we're going, okay, but what's the accessibility? What's another way for this individual to get in? So we work a lot in that capacity. And Mark, I think you get the same calls. Someone will call and say, hey, we have a swimming pool lift at our apartment, but it's not working. Can someone help them to fix it so that it can work? So Don, in answer to your question for the subcommittee, I think with the CILs, while it's not a fully certified campaign, it's an everyday campaign for individuals to learn self-advocacy, to learn about their rights. And we're not shy about placing a call. But again, when we call, we want to see a win-win solution. We're not the big bad people with the stick coming to say, you have to fix that. It's like, well, let's see if we can find funds. Where would there be funds to help you do this? So it's a different approach. We just want our community to be accessible. Thank you.
Thank you. Thank you both. I really appreciate that information. I have to say that we have lost Dee Dee. I'm not sure what happened, but we no longer have quorum. So I think I need to provide one last public comment opportunity before I close this out, regardless of having quorum or not. So let's go ahead and allow that, and then we'll just continue this agenda item at our next meeting. We'll plan for the next meeting. I'll send out another poll so that we can plan it. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be allowed at the end of each day and will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and provide the secretary with written comments. Are there any last final comments? Okay, and I apologize for having to end the meeting for not having quorum, but we'll continue this discussion next time. Thank you, everybody.